Hello and welcome to the LEAPcast. On today's episode, we're talking to Ray Newman about content design and why it's so important in digital health. Ray explains how saying poo could save a life and gives us some practical tips for digital health app design, including how to reduce cognitive load and developing a user-centered mindset. Ray is lead content design consultant at CGI. He's previously been a freelance journalist, award-winning author and copy editor. In his role as lead content design consultant, he works primarily with public sector clients. In his spare time, he writes ghost stories for fun. Could we just start by talking about what is a content designer and how does it differ from other forms of writing, for example?
Yeah, sure. Content design is relatively new. So if you don't know what content design is or haven't heard of it, that's not you being dense. It's actually only really been invented in the last decade or so and only become very common in the last few years. It started in central government and spread out from there. As you said, my background is in content marketing, journalism, editorial, and I think a lot of content designers have come from those more traditional content backgrounds. What makes content design different is that the focus is designers who work with content. So it's sort of, for me, it was a complete change of track. Even though I was still working with content, I had become a designer. I was user-centered design, human-centered design, these terms that you'll hear people talk about. I'm working much more closely with people like product designers, visual designers, and service designers. Content design is very much focused on helping people complete tasks, find information that they need as quickly and efficiently as possible. So if you compare that with, say, copywriting, you might want to be sort of witty, engaging, entertaining, funny. And in the world of content design, you might very occasionally do that, but it's much more usually about stripping that stuff away, telling people why they're on a page or on screen in an app, what they'll find there, what they need to do, and giving them a big green button to hit or something like that. So it's just really getting people where they need to be as quickly as possible. And one of the first things I worked on after becoming a content designer, sort of one of the strands of work I was working on was around helping people book vaccinations during pandemic.
Okay.
And that was a really good example of where content design suddenly became really useful because we had to explain the complex terms and conditions around vaccination. We had to explain how booking worked, who was eligible, who wasn't. So it's taking complex information and making it as clear and accessible as you possibly can.
And it sounds quite a lot like you're on the side of the user. What you're doing is helping the user.
Yeah, that's certainly how we like to think of what we do. We have content designers working in private sector settings where sometimes there's a bit more of a tension. And I always, because I did copywriting for a while, I like to stick up for copywriters as well. There's a user need that we're trying to answer there sometimes, which is, I don't know which rucksack to buy. Well, that rucksack is the one that speaks to me more. So you're helping people make a decision. More cynically, sometimes you're helping them, selling them a rucksack that's not as good as the other one. But anyway, there's a user need there as well. But yeah, you're right. Broadly speaking, try to champion the needs of users.
Yeah. Okay, great. And so the Leap Digital Health Hub is completely focused on health problems, clinical problems that have a digital solution. So you've worked with the COVID vaccine. Is a lot of your work health related?
Yeah, I've done work with the NHS and in other healthcare organisations. I'm currently working with an organisation in the healthcare sector as well. So, and I guess things that I'm hoping we'll talk about today are key concepts like cognitive load and trauma-informed design. That in this context, you really need to think about. People are not coming to healthcare services. I always describe it as this ideal user who's sitting with a nice cup of coffee in a nice quiet office. Everything's peaceful. They've got nothing else on their agenda today. They're just sitting there ready to engage with your service. And in healthcare, it's very rarely that. Often people are coming to healthcare services in crisis when they're very worried, very anxious, sometimes the worst time of their lives. So their cognitive load, even before they get to your website, is incredibly high. They've got very little capacity to process complicated ideas or deal with difficult interfaces. So in terms of the work I've done in healthcare, that's been the great lesson from it really, is that you almost cannot make it too simple, too straightforward, or you have to assume that the user is under the greatest possible stress with everything you design and try and design for that.
We sometimes hear, especially from clinicians, that oversimplifying things within an app or some other kind of service is patronizing. And I can sympathize with that view because obviously clinicians go to great lengths to not patronize their patients, ideally. What would you say to that this idea that the oversimplification might be a bit patronizing?
Well, I've got a couple of thoughts on that. One is, ideally, you will always design the content for as specific a user group as you can. So if you know your service or your app is only being used by, I don't know, professors of comparative literature, then go mad, fill your boots. But in reality, most services have to be designed for the widest possible audience. We don't have time, aren't able to tailor them or personalize them on the fly. And you have to assume that you have to design for the most vulnerable user with the least confident English and the highest cognitive load. And if some people then find it patronizing, well, kind of tough. Were you able to understand what it was about? Were you able to get the help you needed? Did you get the treatment you needed to prevent a condition becoming worse? If at a couple of points in that process you rolled your eyes because it seemed patronizing, well, that's probably a price if everyone else can also access the service.
Yeah, it's the price to pay for the person who was able to make it through because of your design.
Exactly.
Yeah.
I remember sitting in a GP surgery when I lived in Cornwall. It was the first time I'd ever seen one of those posters that said, "Have you got blood in your poo?" And I was just like, "Oh, for a start, that's disgusting." And also, it's childish. I'm not a toddler. And I found it personally quite irritating. But I've become quite evangelical about it since working in the NHS alongside some really brilliant people who did work on exactly why they used the word poo. And it was not careless. It wasn't a knee-jerk reaction. It was based on something like 40,000 individual items of feedback from website users. That word, whether you like it or not, is the clearest, most universally understood word. I love to use that example because it demonstrates the point that everyone's quite uncomfortable with when you say it in a meeting or you mention it on LinkedIn. But it makes the point that universal understandability trumps manners when it comes to healthcare situations.
It's such a good example as well, because that example could literally save a life.
Exactly.
Our users aren't always patients. Sometimes they're clinicians. So if you're dealing with note taking or ambulance crew recording details, your user then becomes the actual healthcare professional, and their cognitive load, especially ambulance crews, must be enormous.
Yeah, and unfortunately, what you see in many organizations is this two-track thing, which is, well, even if they're committed to designing to the highest standard for end users, if there's a resource crunch or it's difficult to find the money, it will be like, well, we can just do the internal stuff to a lower standard that they can put up with the bad interface. And unfortunately, that's such a shame to me because, as you say, these people are arguably, have just as high cognitive load, if not higher in some cases. And if you could make those internal systems work as efficiently and to be as usable as those external systems, I just think of the huge savings in terms of people's stress and frustration and the danger that you get shadow IT. So this is the thing we've often observed is that if you make the systems difficult to use, people will go, I'm going to make a spreadsheet. I'm going to just use WhatsApp. So you start getting these things that put data in danger that you've got an Excel spreadsheet floating around on a hard drive that goes out of sync with the main system. Like if the main system is designed with those internal users in mind, is easy to use and sort of, I don't know about a pleasure to use, but at least doesn't frustrate people, it's more likely to get used. Yeah,
shadow IT. So shadow IT, they not only find a different way to do it, if the way that you've designed is full of friction, they might not even necessarily revert to the old way. They might find a brand new, not very secure way of doing it.
Yeah, exactly. Often for quite good reasons, because their instinct is, if we do it this way, we'll be able to deliver the service we need to more quickly and efficiently. Crunch moment, we're thinking of patients or service users. It sometimes comes from the right place, but yeah, obviously huge risk attached to people just using whichever system they feel like.
Yeah, because I think we tend to design as if users have unlimited time, attention, and brain power. And I think when we were initially talking about this podcast, you said yours is not the only thing in their life, and I really liked that. Do you think that is a useful mindset for developers to get into?
Yeah, absolutely. And what I find strange is that people, you have to nudge them to think like that, even though in their own lives. So someone is designing an app or a website or a service, and they are designing it with that kind of slightly peculiar view of that the user is in a vacuum and yours is the most exciting thing in their life of using your prescription ordering app or whatever it might be. And then in their own lives, they know that they've got 3 different apps because they've got kids at different schools. They've got one for each school. They know that they've got a different app that they have to use to order their prescriptions, another one to book appointments at the GP, the NHS app for something else. So they know all of that from their own lives, but somehow it doesn't always translate into what they're designed for their own users. And the thing I'm always saying to people is, please just go and try and use your own system, like as a user.
Yeah.
Try, just see how it feels. User research is great as well, but actually sometimes just watching people try to use their own product and seeing them understand how frustrating it can be is really powerful.
Because people are quite bad at almost observing themselves and self-reporting. But when you actually watch someone and what they do, it can be quite different to what they feel like the experience is like. You can see what they're getting wrong, what they're stumbling over. Certainly for me, a lot of this is really resonating because I've definitely got apps that I've completely stopped using just based on the notification frequency alone. Would you say notifications is one of the bigger ones? Have you got other examples of how health services might overload their users?
Notifications is a really important one, and there's also a bit like with the shadow IT. There's a serious risk attached to the over proliferation of notifications. So the BBC's reported on this, and as a few other outlets, which is that if people get too many notifications, they just turn them off or block all notifications on their device because they just get completely frustrated by it. At which point, the actually helpful notification from, say, the NHS app never makes it through to you. And there's something about, I feel like a notification should almost be like a nuclear level event. I don't need to be actively notified.
Yeah.
Canva's launched a new feature. I'm not, that should be something, it's not an urgent issue.
It's not.
The notifications are a big one. And I think it's the fact that all apps come with notifications on by default. And I think there's also a sense some service providers have, well, we need to notify them about something so that they remember we're here. So it's almost the junk notifications are the worst. They're marketing driven, almost notifications for the sake of notifying you about something. Less is more with notifications, I think.
Are there other examples? Another very personal bugbear is being logged out every time. And as someone who works in digital health, I'm very aware of the need for security. So I try really hard not to get angry. But every time I'm logged out and then I have to go through a lengthy login process, I will just disengage, especially if it's something I'm expected to engage with several times a day.
Yeah, that's another really important one. I absolutely understand why all the two-factor authentication and logins are there. However, yours is not the only login, two-factor authentication, PIN number in my life, and probably is not the most important one to me. So by the time you've got, say, a bank and maybe a building society, and you might be also using PINs and two-factor authentication for the app for your child's school or whatever, then all of those other ones suddenly just become a real frustration. And also apps you don't use very often. I know people who don't bother remembering any passwords for certain apps. They only use them once or twice a year. So they just do forgot my password every single time. And that just feels counterproductive. I don't think there's an easy solution to that. I just think at some point it was decided that security was the user's problem. Because if it's not, it's an enormous problem for industry to solve.
Especially in health. I think this is another way in which health is different. Can you think of examples of where we've seen simplicity done well in healthcare, or maybe outside of it? Because obviously digital health is a fairly new field, really.
Yeah, I always point people to the NHS and the UK government. And I think Gov UK is a great example of a few things. One is what happens if you divorce a service from political turbulence. That was launched in about 2010-11 and has been allowed to mature through successive governments. Because every government has agreed digitizing services would create efficiency. So it had the support it needed. But doing your tax return online in 2012 was quite painful. And every year it's got easier and less stressful, and the logins got simpler. To the point now where obviously I still put off doing it till the last possible minute, but it's less.
Of course,
I get less angry while doing it than I would on the decade. So I think it's something about that repeated patterns, recording best practice, applying it. If you design a service anywhere in government, the first thing you do is look at what's already being done in other services that we know works. Can we build this from existing components and patterns rather than from scratch? What research have we already done into this user group? So it's that sort of paring things back. And a question you often hear being asked in NHS and government public sector contexts is, what can we remove from this page? And back to your question earlier, what's different about content design? A copywriter or an editorial person, and when I was doing that, I was judged on how many thousands of words I turned out in a day, essentially. So, I always talk about the day I wrote 3 blog posts and 14 website pages in a single day, nearly killed me. Whereas in content design, you might spend 3 months working on something and you only write 3 words, or you write none, delete a page. And that's the outcome. Like, based on research, based on insight, we can remove this page and simplify the journey. And that's like a huge win. Every time you remove a step or a page, you've reduced the cognitive load of using the service.
I was going to say, that's so interesting. So essentially, you're trying to simplify things as much as possible, reduce steps, reduce content, And all of those things are each building towards a reduction in cognitive load.
Yes, exactly that. There are various reasons why you need to keep cognitive load down. So one is from a usability point of view, making it as easy to use for everyone as possible, but also with accessibility in mind. If you design a service with a low cognitive load, with content that's easy to scan and understand, you make it work for people with dyslexia or with other disabilities. Sometimes people talk about accessibility, designing for people with disabilities as almost like a step you do at the end or another track you take. And it's actually, if you design everything to have the lowest possible cognitive load, to be easy to understand, to, we don't use this language as much now, but, the reading age of 9 or the reading age of 10, and it works for everyone. And the thing I always say, you will never get anyone who says, oh, I hated how simple and easy to use it was. Like, it will work better for everyone.
Yeah, that's so true. It's something that I've never really thought about before, but designing for the person with English as a second language or dyslexia is very similar to designing for the ambulance crew at the trauma scene.
Mm-hmm.
They're both having to hold a lot of information in their head to try and complete the steps. So anything you can do to help that benefit both of those very different groups of people.
And we get into the nuts and bolts of things like a rule most content designers would follow, sort of derived from UK government design standards, is don't use negative contractions. So you'll always see, you will not be charged for this service rather than you won't be charged for this service. It's a bit counterintuitive if you've done copywriting, where it's always use contractions. It makes it feel more human and warm. But there's solid research that shows just that split second of trying to pass won't makes it harder for people. They might have to read it twice, or they might just take a moment longer to understand it. Whereas will not just goes into your brain faster, essentially.
Wow,
so
that's
even though it's a bit clunkier, we will almost always spell out negative phrases in full, and then positive ones will contract. That's fine. They're just fine. It's the negative ones that are difficult.
So actually, these very small design choices can have a big impact on clarity and calm.
Yeah, and the only way we get those insights is through research. So it's designing as things in wireframes, we call them, or prototypes that we can put in front of people as early as possible, observing people using higher fidelity prototypes to see what frustrates them, what blocks them, and just as quickly as we can, really getting through those iterations. And again, back to the UK government website, it's the reason the tax website is easier to use now than a decade ago. It's just constant small improvements. Change the text on the button. What if the button's in the middle? What if the button's, what if the other button's text rather than a button? What if there's all these tiny little things that add up to just a simpler, cleaner experience. On the thing I worked on recently, we just restructured the navigation at the top. We just moved a few things into different columns, put a couple of headings in, and it was night and day. Even though if you tried to sell it to some product owners, they might have just said, well, that seems like a lot of effort to go to for not very much return. You put it in front of people and it's just, it's instantly understandable. Whereas the old one just took a bit of passing and a bit of concentration, which, people shouldn't need to do.
So do you have any other kind of favorite small design choices that you find have a big impact?
Yeah. So when I do, I've got a training course I sort of do on demand, and like an hour long training session on sort of an introduction to content design. And there's an exercise in that, which is to show a paragraph of text, which is pretty much how most people with a university degree would write a paragraph, because they're very proud of being able to write nice long paragraphs, and they would whack it in the middle of the page. And the exercise is just to break that, put more line breaks in, put headings in, use bullet points, and it's exactly the same text. But once you've got bullet points and headings in, it becomes 100 times easier to scan. And I think headings are an absolute superpower, because people will sometimes say nobody reads, and it's not that they don't read, it's that they don't read every word. So if you've ever been in one of those meetings where people are bickering over whether to say exactly this word or that word, most readers will never notice. What they will do is scan the page in kind of an F shape, and they will scan the headings and then maybe come back up and read a bit near the top if it seemed relevant. So if you get your headings right, it's like you've sort of opened up the whole page to people, and they can read it or understand it at a glance, and then zero in on the bits relevant to them. And people don't use them enough. I don't really know why.
That's super interesting. So you've mentioned a couple of times now that there are government design standards. Is this something anyone can go and look up?
Yeah, they're all published online. So it's the GDS, the Government Digital Service, GDS Service Standards and Service Manual, and the NHS has one as well. I often recommend, when people say, I want to learn about user-centered design or content design, I say, go and just immerse yourself in those, because they are written really clearly. as you would expect. They're laid out really clearly, and every item in them will usually come with here's the evidence base for this decision. Here's why we say poo or whatever it is. So you can get almost a whole content design training course out of it. And I would say most organizations of any size or seriousness should think about. What I would say is take that as your starting point and then use that as like create your own style guide or service manual. They've already done a lot of the hard work for you.
Mm-hmm.
I do recommend people just even nose around. They're really interesting that it's all public.
That's great. I will link that in the notes as well, because that sounds like a super useful resource. How does reducing cognitive load improve accessibility for, I guess what you would call temporary impairments? Maybe people who are very stressed, they're going through a diagnosis. How does reducing cognitive load help there?
Yeah, I think most of us at various points are temporarily not as able to digest information as we might be. So examples that sometimes you talk and you see light bulbs go on with people are, what if you've got a newborn in the house and you are not sleeping? Then suddenly every interaction becomes harder and more frustrating. And any interaction you can have with a service that is simple and quick, you're so grateful for. And the same goes for if you just have insomnia, or you broke your wrist and wait for it to recover, or you're carrying heavy shopping bags, or you're on a noisy train. There are all these situations where suddenly our ability to process information becomes compromised. If you can make a service as clear and simple as possible, if you can make the top task really obvious on the page or the screen, help people understand why they might want to click the button and get them into the journey and moving along, you're just saving them a lot of, they don't have to make so many decisions, basically, keeping things nice and simple for them.
Can you explain a bit more about what a top task is? So if I was developing an app right now, what would an example of a top task be?
But these are things we spend a lot of time researching and trying to pin down, because actually typically, especially with commercial websites and products, you might have 25 people who all think their thing is the most important thing in the world, should be on the homepage. Can it be in the top? And there's an old joke in design about carousels, that sort of scrolling carousel thing. The reason that's there is so you can tell everyone on the board their things on the homepage, basically. And deciding on the top task can be a tense conversation. You can have a lot of debate and it can be quite emotive. But usually there is one thing on a service page that you want people to do primarily. So it might be, for example, if you've got a service which is about helping people deal with alcohol addiction, what you want at the top is for them to click the button that says sign up for alcohol addiction counselling. And then the other stuff, follow us on Twitter or, read about alcohol addiction, all those other things that are useful. The top thing on the page you want them to do, the measure of your success as an organisation is that they are registering for that service. So that's kind of the top task. And then from a user perspective, I want to book a flu vaccine.
Yeah.
I land on the website and the first thing I see is about cosmetics offered. And the second thing I see is about your amazing press release about your rebrand. Where is the useful thing for me? And when we talk about top tasks, it's kind of what the user wants to do rather than what you want to make the user do.
Okay, I like that perspective. Something else that you've also mentioned is trauma-informed design, which is something I'm really interested to hear about. So what does trauma-informed design mean in practice?
So this is, again, an even newer concept, really. I think most of us have been practicing it without knowing we were practicing it. Knowing about it has helped us practice it better. This is the idea that you design services on the assumption that people using that service will be carrying trauma from past experiences with them. Everything I know about this, I learned from a former colleague, Miriam Vaswani, who I need to shout out, and collaborator and colleague Rachel Edwards, who edited a book on trauma-informed design that came out, I think, earlier this year, might have been late last year. And Rachel's also written lots of really good blog posts on the subject for Content Design London. And in that book, there's an essay that talks about small t trauma, big T trauma. And you might think none of the people using our service have trauma, because you're thinking they might be refugees from a war zone, or they might have experienced political oppression, might have experienced serious domestic violence or something like that. First, you can't assume that no one in your user group doesn't have big T trauma. But actually, a much greater number probably will have small t trauma. So things like they might have been bullied at school, or they might have, one that's very important to me is they might have gone through financial hardship and experienced poverty. And they might now, to you, read as a perfectly capable person. You present the service, and at the end of the service, you spring a hidden charge on them, gives them a panic attack, or sends them spinning out because suddenly they're worried about whether they can afford the service. They hit cancel, they close it. Or you ask them to specify their gender, and it sends them crashing into all the anxiety they've felt about their gender identity and the difficulties they've had in how people have treated them in society because of their gender identity.
Mm-hmm.
And actually, maybe you don't need to ask them at all. That's the kind of common thing with these things. So the trauma-informed approach might lead you to say, why are we asking for this information? Do we actually need it? Then you do some research and say, if we do need it, how do we ask for it in a way that feels reassuring, that makes people feel safe, that doesn't re-trigger their trauma, essentially? So it's about designing for the people with the greatest need. And the chances are everyone else won't notice. And if they do, they'll quite like it, or they'll find it just makes things easier. It comes back to cognitive load as well. The people who are carrying trauma often are carrying high cognitive load just most of the time. And especially if anything happens to re-trigger their trauma, their cognitive load would increase and your service will suddenly become unusable or challenging.
So, in a way, ideally, if you've done some really good work behind the scenes, making your app or service trauma-informed, no one will notice.
No, exactly. They shouldn't. They should probably just get a sense that that was a very calm, pleasant experience. I enjoyed using that app.
Right. Okay. Yeah. Again, not having these things as an afterthought, but actually baking them into the whole design process. Having that mindset all the way through so that you're not creating something you then have to essentially go back and redesign with all these things in mind.
And that's, you've probably picked up, because we've been sort of connected for a while, and you probably picked up on me moaning about this. What often happens in environments where user-centered design isn't built in or isn't fully accepted, someone will come up with a feature, it will get developed, the engineers will get involved, marketing people will get involved. And then at the end, someone will say, can you just quickly make it accessible? And what you can do at the end is look at it and say, well, it will be more accessible if you do the following few things. But accessibility by that point has probably been fatally compromised because you didn't at the very start say, how will this work for people?
Yeah.
Who can't perceive color, for example. So it's those kind of things that are often just not thought of. And if you have those accessibility consultants or user-centered designers in the room all the way through, or as early on as you can, they will flag those things before you've wasted a lot of time and energy building them. So you build the right thing first time rather than trying to fix it at the end.
So if I'm a startup and I can't afford my user-centered design consultant, are there design patterns or testing approaches that can help me identify potential triggers or stress points?
That's a really good question. So I think for startups, looking at the GDS guidance, so the UK government guidance and NHS guidance, there's loads of good pointers on there on accessibility checklists that you can run at the start of the process, so accessibility standards that you could apply at the very beginning. And I would say, in terms of affordability of user-centered design people, one thing to be aware of is that I think if you've got a designer in the room with a user-centered background, whether they're a visual designer, a service designer, or a content designer, even if they're not able to do all of those things, they will at least be able to pick up on things like accessibility, cognitive load. They'll understand those ideas. So just trying to get at least one designer in the room somewhere is a good idea. And yeah, I would definitely look at UK government and NHS accessibility standards and checklists as a good starting point.
Fantastic. If you could redesign one digital health service tomorrow, where would you start?
I use an app to reorder my prescription every month. And it used to work brilliantly. And the company that made it was taken over by another pharmacy company, and they keep making it worse every month. So I would probably just roll back to the simple version that I first used. Let me press a button to reorder my prescription, deliver my prescription as quickly as possible. 3 clicks, lovely. And they keep trying to make me do other things like learn about vegetables through the app. And I'm like, it's fine. I don't need you to do that for me. So keep it simple, I think, and avoid the feature factory on that one. Yeah, I've rolled.
Oh, that's so interesting. I think we use the same prescription pre-order app. What's one small change every digital health team could make today to reduce cognitive load?
Okay, so I would say and this is maybe easier said than done, but look at every leaflet or PDF or bit of guidance or web page and just try to reduce the number of words by 30 to 40%. I can almost always do that without compromising the content. And the minute you do that, the phrase you hear people talk often is wall of text. People, when they're in a user research group, see a wall of text and they just panic or react against it. And when I've done research with people with dyslexia, that's enough sometimes for them just to say, I'd have to come back to that later. I'm just out. If you can reduce the wall of text and then maybe add some white space and some headings, even before people have read a word, you make it more approachable, more digestible, less intimidating. So I would say, just try to cut back the waffle is number one thing you can do.
Amazing. Thank you.
Well, thank you very much.
This has been a super useful discussion, and I feel like we've got lots of resources that our listeners can use to go and find out more. So thank you very much. Thank you for listening. If you enjoyed this episode, follow the Leap podcast on Spotify or Apple Podcasts and sign up to our mailing list to find out more.